sometimes an endless stream of pills and capsules. These drugs are usually prescribed, but sometimes that's done carelessly or without good reason. And as more and more drugs are taken, side effects multiply, and the consequences can be tragic. Geraldo Rivera has investigated this situation, and if you think it's an isolated problem, you'll see that it is not.
Most of us have heard the horror stories from inside the institutions of elderly people being improperly medicated. According to congressional testimony, improper medication kills as many as 30,000 nursing home residents a year. But the vast majority of the elderly don't live in institutions. They live right here, at home. And although the problems here don't usually make the headlines, there is a hidden epidemic of drug misuse that is widespread and dangerous.
Because I was taking, it was making me nauseous and confused. I went to the bathroom and I fell right down the bathroom floor.
They gave me more pills, and I think some of them was the wrong kind. I just went out of my mind. I didn't know nothing.
What, were you taking 20, 30 pills a day?
Yeah.
And how many of those were unnecessary?
All but one.
New drug therapies allow millions of older people with chronic illnesses to live longer, more active lives. But since the elderly living at home frequently suffer several medical problems at any given time, they take many different pills, often without proper medical advice or supervision. Medication can and does work wonders. The focus of this report, though, is what can happen when an older person misuses a good thing.
Dr. Jekyll and Mr. Hyde.
A victim of both diabetes and heart disease, 80-year-old Fred Johnson is apparently suffering the side effects, which often result when different medication for different illnesses are used without sufficient regard for how the drugs interact.
What date is it?
Today, 22nd.
Of what?
Of May.
Okay, what year?
1987.
Over the past 6 months, he's become increasingly confused, his behavior more and more unpredictable. His condition deteriorated to the point where his wife, Doris, feared she could no longer keep him at home.
He is becoming, though, increasingly irritable, unmanageable.
In desperation, she brought Fred here to Bellevue Hospital in New York City, where a team of geriatric specialists are probing a disturbing possibility, that his confusion and disorientation are caused, or are at least aggravated, by the multiple medications his doctors have been prescribing.
The only thing I'm going to take is vitamins.
He doesn't take it as a regular diet. It's a complete personality change. I mean, everybody knows it. He speaks for 2 hours at a stretch, then he starts to cry, and he hyperventilates, and he retches, he's sick, and then later he's singing.
Is there any doubt in your mind but that the condition that we saw was at least aggravated, caused or at least aggravated by his medicine?
No, there's absolutely no doubt. He was on a combination of several medications which ended up lowering his body salt and making him hold on to too much water. Now, this combination of too much water in your system and too little salt also affects our brains. And it makes you very, very confused. Gives you very strange and bizarre behavior. If bad enough, it can even lead to coma and death.
Most elderly people run a high risk of side effects, and they run a high risk of feeling worse on medications than when they were off of them.
Mary Young, a visiting nurse who works near Boston, believes much of the responsibility for the problem she sees lies with doctors who fail to follow up when prescribing medications for the elderly.
What happens is that elderly people tend to have a lot of physical complaints, and the easiest way to address a physical complaint is to treat it with a medication. What then happens, though, is that no one ever makes a decision about whether that medication worked or not. And with the next complaint, another medication is started. So someone who maybe started off on 2 pills a day suddenly finds themselves on 12.
My name is Rose Simley.
Reports of prescription drug use and misuse by the elderly became so widespread and serious. Last summer, a joint congressional committee began an investigation. In 68-year-old Rose Zimney's case, over-medication made her almost psychotic.
So I became so confused and disoriented during this time, to the point where I would wound up in the psychiatric ward with hallucinations.
Now recovered, she and her adopted daughter Gloria agreed to tell Congress how it all had happened.
At the end of 1980, my mother was brought early in the morning to a local hospital because she couldn't breathe. We brought her into the emergency ward and the doctor admitted her into the hospital. What happened then was that he couldn't control the asthma, so he repeatedly started to give her all different types of pills.
Every time you complained about something bothering you, they give you another pill?
Mm-hmm. Look, he's the kind of a doctor that you tell him your neck hurts, he'll give you pills. You tell him your arms hurt, and he'll give you pills without checking.
I happened to be up there one day when I saw them giving her 12 pills all at once. She wouldn't eat. She just wouldn't do anything at all. She was completely incoherent. At times, she knew who I was, and then she didn't. And she kept on saying over and over again, it's the pills, it's the pills.
This is an incredible amount of medication. Did it ever seem curious to you that you were getting so many different prescriptions?
Well, he says if I didn't take them, I'd die.
Look at the amount of medicine Rose was taking. At the peak, she was using 22 different medications, 40 pills a day. And the only thing really wrong with her was asthma complicated by anxiety. Fortunately, her case came to the attention of Dr. Jonathan Leaf, a geriatric psychiatrist here at Hahnemann Hospital in Boston. An expert in the problem, Dr. Leaf cured Rose by reducing the different medicines she was taking from 22 down to 3.
The doctor felt he was justified because she started having falling, probably from the side effects, and therefore he gave anti-falling medicine. Then she had indigestion, so he gave an indigestion medicine. Then he had trouble sleeping, so he'd give an antidepressant. Then he had trouble with anxiety, so he'd give an anti-anxiety pill. And then the additive effects were just too much.
Is the cure sometimes worse than the disease?
Well, in Rose's case, it certainly was. She became psychotic from the medicine. I don't know whether the doctor knew enough to have stopped some of these medicines, but certainly they were not paying attention to what they were doing.
According to the experts we've spoken with, part of the problem is that doctors are conditioned right out of medical school to seek the dramatic cure, to fix a problem with surgery or alleviate a complaint with a pill. But geriatric medicine, treating the elderly, is more complicated. And our experts tell us more doctors must realize there is no pill to cure old age. Having said that, though, we don't want you to think that it's all or even mostly the doctor's fault, because it's not. Very often, the elderly themselves must bear responsibility for misusing their medicine. Michael Flaherty, director of the St. Francis Addiction Treatment Center, recently concluded a poll of the senior citizens in the Pittsburgh area, with some disturbing results.
Our study found out that nearly half of them didn't comply with the doctor's orders. Either they under-medicated, over-medicated, didn't medicate themselves, or used other medications anyway.
So nearly half of the elderly surveyed admitted they did not follow their doctor's orders. But why? There are several important reasons, some as innocent as old age itself.
I just went blind recently.
79-year-old Marguerite Allen has had a great deal of difficulty taking the pills she's supposed to when she's supposed to because of her physical infirmity. Now it's becoming increasingly difficult to keep her medicine organized the way she used to.
I kind of get mixed up with the fluid pills. This here I can tell by the shape of this. They do mark them, but now I can't see the marks now like I used to be able to.
70-year-old Emily Gaff had the same problem, partial blindness complicated by memory loss and confusion. In her case, however, the Visiting Nurses Organization helped organize her medicine on a daily and dosage basis.
And the nurse had to come to separate them for me because I couldn't see to do it.
Could you do it yourself now if you had to?
No.
Visiting nurses like Mary Young are often available to help the elderly deal with the complicated process of taking many different medicines at different times.
Most elderly people cannot intellectually or physically handle more than 3 or 4 medications. It's too complex a task, regardless of their education ability or their experience. And although most patients will tell you they don't make mistakes with their medications, compliance, meaning, the ability to correctly take their pills, is at best 50–60%.
Another reason for non-compliance is the fact many older people think medicine too valuable to throw away.
I would find patients with drawers full of pills that they'd collected over the last 20 years, and they would take a couple of these and a couple of those, and they would give them to their friends and say, try one of these. And this hoarding and swapping of medications in families and among patients is certainly prevalent.
62-year-old Jessie Siegel has a medicine cabinet filled to overflowing with drugs she's accumulated. She admitted to me that she hoards old medicine.
I've kept the medicine, and then sometimes if it reoccurs, like vertigo, I get dizzy spells, I'll take it.
Do you go back to the doctor to see if you should still?
I can't go back for everything. I've got 99 things wrong with me. If I stopped for everything, I'd never get any place. No, I cure myself on a lot of things.
At this meeting of senior citizens in Philadelphia, we discussed the dangers of this kind of hoarding and also the principal reason for it.
Money. And that's the name of the game. It's the money, the dollar, that is so very important for us senior citizens that we are doing things like this.
Even more dangerous than hoarding is the apparently common practice among the elderly of swapping, trading old medicines amongst themselves.
One night we were playing cards and a friend of mine asked me, do I take this and this medication? And I said yes, and she said, well, I have a bottle that I've never used. She said, here.
The motive for swapping is often the well-intentioned belief that someone else can benefit from medication even if it wasn't prescribed for them. But the risk far outweighs the benefit.
If you're swapping a medication, if you're giving a friend a medication, say, will this work for me? You don't know it's going to work in your friend. Second of all, it may contain something that your friend cannot take. If it's been around for a while, it may have broken down into something else that can be quite damaging.
According to Dr. Peter Lammy, the problem is aggravated by the vast numbers of drugs available, many of them right over the counter.
How serious is this problem? Do we have a drug epidemic among the elderly?
We may very well have, not only because we prescribe too much, but because they also use too many other things that you can buy.
Arthritis isn't about to come between me and my children.
Emerson.
Over-the-counter medication, or OTC products. We've all seen the commercials, but have you noticed how many of them are pitched directly at the elderly?
For hours of relief from minor arthritis pain.
The majority of the elderly use the over-the-counter drugs. Mostly pain relievers, they use laxatives, vitamins, and antacids. But according to a recent survey, 70% or more never tell their doctors that they're using the OTC drugs in addition to what they are being prescribed. What most elderly people don't realize is that the combination of the two can be dangerous.
In general, we don't ask, what else do you buy from the health food store, OTC drugs in the supermarket?
Over the counter.
What do you get through the mail order business? Because we have always viewed that as no drugs. And yet they are potent drugs that can interfere with the prescription drugs.
One easy way for anyone to avoid getting into trouble with prescription medicine is simply to talk with your doctor about what the medicine prescribed is supposed to do, why it's necessary, and how it may interact with other drugs you're already taking. With that important communication, especially between older patients and their doctors, is often non-existent. The doctor's frequently very busy, while the senior citizen, on the other hand, is often too shy or embarrassed to ask the questions. Well, here in the Pittsburgh area, an elderly task force is traveling around with an important basic message. Don't be afraid to ask questions.
The word that you're supposed to take foods with, does that mean prunes or vegetables?
No. And if the doctor is unavailable, local pharmacists, like most of the people on this elderly task force, are a readily available and often overlooked source of medical information.
Always better to stick with the mildest drug possible.
Remember, your question could be a matter of life and death.
I used to sit with my mother-in-law and make lists and say, this is what you want, the information you want from the doctor, this is the information you want to bring to the doctor. And then when she came home, she said, well, the poor guy was so tired and harassed and he had 6 people waiting in the office, and I'll do it next time. Next time, of course, never comes.